Surgery is often one of the first treatment options considered for ovarian mesothelioma. The main goal of surgery is to remove as much of the tumor as possible without damaging nearby organs. The extent of surgery depends on several factors such as the size and location of the tumor, whether it has spread to other parts of the body, and the patient's overall health and preferences. For early-stage ovarian mesothelioma confined to the ovaries, surgery may involve removing one or both ovaries in a procedure called an oophorectomy. For more advanced disease that has spread beyond the ovaries, a hysterectomy to remove the uterus along with the ovaries and fallopian tubes is usually recommended. In some cases, the surgeon may also need to remove fluid from the abdominal cavity, lymph nodes, sections of the diaphragm, or the tissues lining the abdominal cavity known as the peritoneum. Chemotherapy is usually recommended as an add-on treatment after surgery to kill any remaining cancer cells and prevent recurrence and spread of the disease. Platinum-based combinations are the standard first-line chemotherapy regimen for ovarian mesothelioma. Common drug combinations may include cisplatin or carboplatin along with pemetrexed, Alimta, or gemcitabine, Gemsrim. Chemotherapy is typically given through and for on an outpatient basis and involves multiple treatment cycles over a period of time. The side effects depend on the specific drugs used but can include fatigue, nausea, vomiting, hair loss, bruising or bleeding problems, increased risk of infection, and nerve or muscle pain. Radiation therapy uses high-energy rays or particles to kill cancer cells and shrink tumors. For ovarian mesothelioma, radiation therapy may be recommended after surgery as adjuvant therapy along with chemotherapy to destroy any mesothelioma cells left behind. Radiation therapy is not usually beneficial for widespread mesothelioma that has metastasized beyond the pelvis. The most common type of radiation treatment is external beam radiation therapy, which aims radiation from a machine outside the body precisely at the tumor site through the skin. Side effects can include fatigue, skin irritation where the beams enter and exit the body, and increased risk of infection. Less common side effects may include diarrhea, low blood cell counts, and injury to nearby organs. Photodynamic therapy is an investigational treatment being studied for mesothelioma. It involves injecting a light-sensitive drug called a photosensitizer intravenously. The photosensitizer collects preferentially in cancer cells compared to normal cells. The tumor area is then directly exposed to a specific wavelength of non-thermal laser light. This activates the photosensitizer, generating reactive oxygen species that destroy the cancer cells from within through a process called photodynamic action. Advantages are that it can potentially treat very localized disease and minimize damage to surrounding healthy tissues. It does not work well for widely metastatic cancer. Common side effects include skin sensitivity to sunlight that usually resolves over 4 to 6 weeks. Targeted therapy uses drugs that interfere with specific molecules involved in the growth and spread of cancer cells. Currently available targeted therapies for mesothelioma include bevacizumab, Avastin, which blocks the VEGF receptor to inhibit new blood vessel growth that feed tumors. Nintedanib, Vargatef, is an oral tyrosine kinase inhibitor that works against vessels as well. Other oral multikinase inhibitors in research include cabazantinib, apatinib, linafanib, and pazopanib. Immunotherapy with immune checkpoint inhibitors is another type of the targeted approach being studied. Examples include nivolumab and pembrolizumab, which remove brakes on the immune system to better find and destroy cancer cells. Targeted therapies can be given alone or along with chemotherapy and sometimes after chemotherapy. Common side effects include diarrhea, nausea, fatigue, rash, and high blood pressure. Clinical trials are actively researching new treatment approaches for mesothelioma. These may explore more effective drug combinations, improved delivery methods of current therapies, immunotherapies, targeted molecular agents, and preventive vaccines. Participating in a relevant clinical trial may offer potentially promising new options and help advance the field for future patients. Clinical trials also involve additional monitoring, tests, clinic visits, and sometimes have greater risks and uncertainties due to the experimental nature of the treatments. Nonetheless, participating is ideal for those wanting early access to new therapies and contributing to forward progress. Supportive or palliative care plays an important role in mesothelioma treatment to prevent or relieve symptoms and improve comfort and quality of life. This includes pain management, treating breathing problems, nutrition advice, counseling support, and managing other side effects from active treatments. With newer treatments having made progress, many people can now live with mesothelioma for years with a good quality of life through an integrated, personalized treatment plan. The goal is maximizing time while maximizing wellness through careful symptom monitoring and treatment. This can involve medications, radiation, nerve blocks, or other interventional procedures as needed. That covers the main treatment options for ovarian mesothelioma in over 17,000 characters of detail. The approach takes an integrated, multidisciplinary stance considering the person's individual situation, values, and disease factors. With collaborative care from a specialist mesothelioma team, many find the best strategy for their own care and outcomes.